to be our next speaker for today. We know that beloved Secretary of IMA Amravati, Dr. Saboo sir, he also is a professor and head of the Department of Psychiatry at PDMC. Sir has many publications in national and international journals. Sir has hold many posts in psychiatry associations and Lions Club also, apart from IMA. Apart from the academician, he is a very well-known chess and table tennis player. Also have an interest in bridge as well as basketball playing. And we all are really aware of his passion for music and really classic knowledge of his Indian cinema is really known to everyone. So without any further delay, I would like to welcome Dr. Ashish Saboo sir on the topic of stress management in the medical practitioners. Sir, over to you.
Thank you, Vikram. Now I will start the immediately with the screen sharing. Now, I'm audible?
Yes, sir. You're audible, sir.
Yeah. Can you see the screen?
Yes, sir.
Okay. So my topic for so my topic is stress in medical practitioners. The overview of my lecture is I will be talking about stress, the definition, pathophysiology, complications, and management of stress, and especially pertaining to our medical practitioners. So what is stress? Stress is the body's reactions to any change that requires an adjustment or response. Stress is a state of mind produced by demands or tasks to be performed, and it is produced due to differences between the demand and capacity. Now, there are two types of stress, eustress and distress. Eustress is the one which actually with the persons is helpful to the persons to improve the performance. Because if that thing is there, then the persons won't get much of the problems and will able to do the work properly. But distress, when the task becomes too much beyond the capacity, then the state of exhaustion of resources occurs, then it leads to distress, and which is the one which causes the harmful effects on the body. Now, the stressor is any factor that demands attention, energy, action, performance, adjustment, and coping. This may be in the form of physical demand, environmental situations, social conditions, and it can be internal or external. Now, what is the pathophysiology of the stress? Initially, whenever the person is stressed, he gets the physiological responses occur. That is, an increase in sympathomimetic activity and increase in adrenocorticoid activity in the body. And there is a psychological responses, which is mostly in the form of a fight response and flight response. Now, the physical symptoms of stress includes, immediate symptoms includes increase in heart rate, blood pressure, sweating, dilatation of pupils, increase in respiratory, bowel movements, muscle tension, increase in sugar level, gastric juice secretion, and long term it results in exhaustion and fatigue. While psychological symptoms, the immediate symptoms are anxiety, hypervigilance, impaired concentration, the person starts speaking rapidly, impulsivity, anger, nervousness, indecisiveness. While long term, the person may land up in depression, may stop going to the work, may go involved in the alcohol or other drug abuse or dependence, and there is overall decline in the performance of that individual. Now, what are the complications of stress? Now, there are many physical illnesses which can be related to the stress, like peptic ulcer disease, diabetes, hypertension, different types of heart disease, various skin disorders, even rheumatoid arthritis can be precipitated, and there is susceptibility to infections due to the low immunity. And the psychiatric illnesses like depression, anxiety disorders, substance use disorders can also. Now, what is the vulnerability of the stress? Who gets stressed easily? So there are genetic factors are there and developmental factors are there, which we cannot alter or there. So we'll focus mainly on the other things. That is, the one is working environment. Now, for doctors or for medical practitioners, the working environment is very important. And here we have to deal directly with the patients. The patient is the one with direct one-to-one contact we face with the patients. There are different types of patients. There's a lot of diversities there, gender-wise, age-wise, linguistic, religion, educational, urban, rural divide, occupational, etc. etc. There are so many different types of patients we see in our day-to-day practice. And then we have to also deal with our staff. There is a different number of staff. Sometimes they are not absent, they are not present, they are not coming, or they're irregular, they are not performing, doing the work properly, they are not talking, communicating with doctors or patients or properly. So their work competence is not there. Sometimes there is a problem with their sincerity and obedience. And the infrastructure where we are working, the setup which we are working in, it may be an hospital setup or a clinic setup, and we are how much comfortable it is, or what are the facilities available over there. So these are all the things which are mainly affecting the working environment. The other thing is professional competence. Now the doctors of various belonging to various categories, they have about different types of qualifications, like graduations, post graduations. They may have taken some kind of a crash course or some certifications, etc. Their professional trainings, how much skill they have developed, about the skills about evaluation, diagnosis, management, what is their level of knowledge, and their most importantly communication skills. It is also very important aspect in the competence, where the person has to be, the communication has to be very clear, proper, worded, emphatic, and graceful. Otherwise, that can cause a stress to the patient. And now specialty specifics. We are like IMA is a group of different types of different faculties. We are seeing just now different types of faculties are presenting different types of presentations. So there are different types of practitioners also. So general practitioners, which are the usually primary healthcare providers, they have got their routine emergency situations, and they have to maintain the proper referrals or investigation. Oh, sorry. And then there are physicians who have got the OPD as well as indoor management. They have to manage, referred patients. They have to refer the patient sometimes to even some super specialties, different specialties, and they have assessment of seriousness. And there is so their hierarchy, their work is more complicated. The surgeons, of course, they have got the different types of tasks they have to perform, the operative, non-operative, operative skills, where to avoid and what kind of things, and how sometimes we are supposed to operate or sometimes we have to avoid it, and the emergency situations or emergency services they have to provide. And some specialists, super specialists also, they have got this, they have to use their knowledge and skills, as well as there are some paraclinicians who have to work skills, handling of the staffs, as well as technical issues are maybe involved. So, and we have to, one more aspect we have to deal with the medical legal issues. So medical legal issues, there has to be proper assessment, notifications, dealing with police and other authorities, or proper certifications, record keeping, and there are negligence which has to be avoided, and the communication which has to be very proper, risk assessment, informing, taken proper consent, or handling the mobs and nuisance, which is a major problem nowadays. And we have to also keep the records properly, which are mainly OPD or indoor records, or of sheets, treatment, procedures, investigations, and certification is also important, whenever we may be giving the certificates about fitness, unfit, disability, death, etc. Now the social status. Now these are about the professional. Apart from professional, we know that doctors is a respected medical practice, is a respected profession, and it has got some kind of a status in the society, and their lifestyle is also very different. It's not like just like any other people. You cannot are not supposed to. You have to maintain certain kinds of your living styles, your eating habits, your dressing sense. Okay, and whatever the tools of comfort you may be using, okay, employing the servants, having big bungalows, vehicles, modern facilities, etc. This is the kind of style usually we tend to maintain. And there are some kinds of habits which some of us may have or may have been deal with, like smoking or consumptions of liquor, gambling, betting, etc. And in leisure activities, we go for parties or some expensive tours or travel, etc. And that is also associated with our financial aspects. The earning sources is primarily our we earn from our profession, and other sources are maybe like job, business, investment in different things which we will do. All these things, the finance, whenever the money matter comes, we have to have deal with whatever the stress associated with that, and expenditure which we may do for our profession as well as to maintain our status, commitments, family needs, all our hobbies and habits. Now, all these things may lead to stress. So, what exactly is how do we manage this stress? There are two major methods which we do it: pharmacological means, which is through the drugs, and non-pharmacological means, which I will be dealing later. So, drugs basically the objectives are usually to control the symptoms, to prevent the long-term effects, and to prevent complications. The medications which may be used commonly are mostly they are antidepressant drugs or anti-anxiety drugs. Sometimes even antihypertensive drugs like propranolol and other things may be used. And sometimes we do use sedative hypnotics to just control the purpose is just to maintain the symptoms. It doesn't actually relieve you from the stress. But so what are the non-pharmacological methods? These are important. Like one is the lifestyle change. Personal growth, we know that we have to grow personally and other things to have, we have to become more assertive. Earning name and fame through appropriate means. That usually can help us to um, uh, keep our stress-free life, keep ourselves stress-free. The reprioritization of goals. The goals must be smart. We have to prioritize them, and we have to learn to say no to whatever the things we are not capable of, or we are not other things. Smart means it has to be specific, it has to be manageable, it has to be affordable, it is reasonable, and it is target oriented. And there has to be increase in feeling of self-esteem, self-efficacy. It is the achieving. Sometimes we can go by doing the small things together, not try to do many things at one time, but do it one by one or other. Spending of our social network. This is also important. We have to keep in touch with our friends, family, communicating, visiting friends, going out, or just relaxing ourselves. Even this, so that can help us to keep us our stress level down. Day-to-day adjustment sometimes we have to do. We need to be ready for change, be prepared for changes. Changes is the thing which is going to be there, and we have to adjust ourselves accordingly. And we have one important aspect we have to keep is the time management. If we do everything on time, so if your routine schedules, if they are fixed, we keep it on time, so it keeps our stress level very low. And we have, but we should not be very rigid about it. We should be a little bit flexible and keeping whatever the times where we keep sufficient time allowed for our planned activity. Work management, we have to work as per our capacity, as per the capacity of, even if we are delegating the work, we have to do it with looking at the capacity of the persons to whom the work has been delegated, and taking breaks in between and learn how to relax. These are some important things while doing the work. Otherwise, this work can add to our stress. If we are helpful to other people, like from friends, family, and community, that always help you relax. Even like I'm involved in kind of a social activity, social gathering, and just helping the people to others, helping others, just gives me a kind of relaxation. I feel more relief from the stress. Exercise is very important. Physical exercise that persons can go in gym, walking, cycling, gardening, uh, stretching at least 30 minutes twice a week is good enough, and other things can be a good relaxing exercise. Yoga, meditations can be done to calm yourself and keep the stress level low. The diet is very important. Different type of color foods like fruits, vegetables, They have got a lot of antioxidants properties. So they prevent the cellular damage, degeneration, cancers, and they also help us to relieve the stress. So in non-vegetarian foods, the fish as well as white meat is good for relieving the stress. In vegetarians, the whole grain cereals, fresh spices, herbs, fibers can help. We have to avoid certain things like caffeine, sugar, fats, or processed foods, which can add to our stress level. And for water, it is better to use a filtered water rather than bottled water. The sleeping habits are very important. We have to keep a fixed time, more or less. It's not that sometimes we are getting up, sleeping late, or sometimes we are getting up early. If you usually maintain a proper time for sleep, it is good. And exercise or no, there should not be any exercise must be done in the day. It's not good that you should walk in the night. There should not be any exercise 3 hours prior to our sleep. It can add to our stress level. If you should, and many of the times we should avoid the daytime naps. The sleep has to be more in the night sleep. The rooms should, if they are dark, silent, and peaceful, it good, gives a good sleep. The color of the rooms should be light, no stimulants, tea, coffee, nicotine, or liquor 3 hours prior, and there should be a gap of 2 hours between the dinner and sleep. Sometimes, many of the times, the people just take the dinner and go to sleep, so it is not advisable. And some pleasurable activities within an hour of the sleep can be done. No emotional disturbances before sleep is advisable. The habits and hobbies. The leisure activities like reading, watching TV, and movies can help in relieving the stress. One should laugh very freely and loudly. There must be some time for fun. The humor also helps in reducing the stress. No alcohol and other drugs for this thing, because it can give rise to, alcohol can give rise to temporary sedations or relaxations, but it causes rebound effect of increasing stress. The creativity can be used in the form of drawing, painting, music, cooking can help you, and dancing and sports can always help in relieving that stress. So that's all from my. I hope I have been able to finish my talk in 10 minutes and without exceeding much of the time. Thank you, Vikrams, both the Vikrams, for giving me the opportunity. Thank you.
Thank you, sir. Thank you very much, Dr. Saboo, sir. Now, I would like to invite our next speaker today, Dr. Naresh Sarde, sir. We all know that he is a pediatric, he's practicing in pediatric